for an update on today. Yeah.
Thank you, Minister. Good afternoon, everyone. Thanks for joining us today. Since the last media advisory, we have four new confirmed cases of COVID-19 in our province. 3 are in the Central Health region. 1 is between 40 and 49 and under investigation. The second is between 50 and 59 and under investigation. And the third is over the age of 70 and a contact of a case. We also have 1 travel-related case in the Eastern Health region between the ages of 40 and 49. Excuse me. There have been 13 new recoveries, leaving 22 active cases in the province, and the total number of cases for our province in total right now is 2,031. No one is in hospital as a result of COVID-19. I would like to extend my condolences to the family and friends of the individual that passed away earlier this week due to COVID-19 in the Central region. You are in our thoughts during this difficult time. As an update, following the cyber attack on our IT systems, we are still unable to pull data on numbers of tests completed. However, in good news, several of our COVID-19 technology tools are now back online. These include the travel form, the COVID-19 assessment and referral form to book a COVID-19 test, and the COVID-19 test results portal. A big thank you to the Newfoundland and Labrador Centre for Health Information for working around the clock to get these back up and running for us. The centre is also now able to collect data on vaccination status and update our online hub. As of November 15th, we have almost 89% of our eligible population fully vaccinated and 94% with the first dose. I'm incredibly proud to say that our province's vaccination rate is among the highest in North America. As we indicated in our last briefing, we will be offering booster doses to those aged 70 and older at least 6 months past their second dose. And while Health Canada has approved both mRNA vaccines for booster doses in those 18 and older, the National Advisory Committee on Immunization has not yet made any recommendation on boosters other than for high-risk populations that we have indicated previously. As well, flu shots are now available through public health clinics, pharmacies, and physicians' offices. If you or your child have not yet had your flu shot this year, please take the time to do so. This will go a long way in helping us avoid the spread of influenza and protect our health system's capacity while we continue to contend with COVID-19. As our COVID-19 vaccination rate rises and provincial and national epidemiology trends in a favourable direction, we are gradually easing restrictions. Effective this past Saturday, we increased capacity limits for indoor and outdoor formal gatherings where proof of vaccination is required. This also applies to arts and recreational facilities such as theatres, arenas, and cinemas. For venues where there is no eating or drinking, gatherings can return to full capacity for spectators in seats with no physical distancing. When not seated, physical distancing must be maintained. Attendees must wear a mask at all times, and the venue must collect the contact information for attendees for contact tracing purposes and retain that information for 14 days. If a formal gathering has eating or drinking in seated areas only, physical distancing is not required between attendees when seated, but is required when not seated. And attendees must be separated into groups of 200, and these groups of 200 people must be spaced apart by at least 6 feet. Attendees must wear a mask at all times except when actively eating or drinking, and the venue must once again collect the contact information of attendees for contact tracing purposes and retain the information for 14 days. As a reminder, formal gatherings are those organized and or hosted by a recognized business or organization. Gatherings within a home are informal gatherings, and these are limited at the moment to the number of people that can fit in the space while allowing for physical distancing. I know that it's easy to look at our high vaccination rate, low case counts, and the vaccine passport and wonder why we still have restrictions in place. The answer is that we have about 35,000 school-aged children in our province who are not yet eligible for a COVID-19 vaccine. We need to keep our collective risk low for them so that schools can stay open for in-person learning. One of the important lessons learned during this pandemic was how critical being in school was for a child's health and well-being. We eagerly await Health Canada's approval of Pfizer's COVID-19 vaccine for children aged 5 to 11 so that we can have this population vaccinated and protected. We are ready to start administering these vaccinations across the province once we get the okay from Health Canada and NACI, and we anticipate it will be 4 to 6 months to have this age group immunized. Provided that the epidemiology remains favourable and no new COVID curveballs come our way, that is the next major milestone for us to ease restrictions. In the meantime, we are constantly monitoring our epidemiology, trends, and evidence, and adapt our restrictions accordingly. All indications are that the COVID-19 virus is on the path to becoming endemic, but it is unlikely there will be any big finish, but rather gradual steps until we reach normalcy once again. Until then, please be patient and kind to one another, and hold fast, Newfoundland and Labrador. Thank you.
Thank you very much, Dr. Fitzgerald. My comments are really around a reminder that we are making regulations under the Public Health and Health Promotion Act concerning vaccines for employees, service providers of some businesses, facilities and organizations. These will essentially require that their staff be fully vaccinated by the 17th of December of this year. In addition to employees and service providers, the regulations may apply also to self-employed individuals and people who provide some services in their home or in a client's home. The employee will have to be fully vaccinated or have an approved medical exemption by the 17th of December, or they're not permitted into the business, facility, or organization. Medical exemptions are available. The College of Physicians and Surgeons in this province lays out those, and the process is that these exemptions are sought from either a physician or nurse practitioner, and the physician can be a specialist or a primary care physician. There is a prescribed a set form that they have to use, and only that form, once completed, will be accepted as proof of medical exemption. These are to safeguard people who use those services and have access to the facilities. Information about the requirements, about the list of businesses, facilities and organizations is available on our website, the COVID-19 website. For those people who do not have access to the internet reliably, there is also a toll-free number, and that will be on our media advisory. For those who have a pen, it's 1-888-654-9424. Other than that, I would like to reiterate Dr. Fitzgerald's comments around getting the shot, but also being aware it is now flu season. We have, because of everyone's cooperation with previous public health measures, had very successful mitigation of flu. We haven't seen cases for the last 2 seasons. It would be nice if, for a variety of reasons, we could bring that on for a third also. So those shots are available. Booking for those appointments was not affected by the IT outage, and I would encourage everyone to protect themselves and their families. So with that, I'll close and hand it over to Leslie for the moderation for the media.
Thank you, Minister. We have 2 media in person and 3 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Peter Cowan with CBC. Please go ahead and make your way to the mic.
Dr. Fitzgerald, you mentioned the climbing vaccination numbers. We're very close to hitting the 90%, that was a goal that you and the rest of the government had sort of set with those catchy ad campaigns. Will anything change once we hit 90%, or do we have to have those kids vaccinated before things will change and restrictions will ease further?
So we're certainly having some discussions about that now at this point as to what will change given how close we are. We haven't come down firm on where that is going to be. I anticipate there will be some changes, but it is still very important for us to get those children vaccinated, for us to have really good protection in the total population, in the whole of the population. And as we saw, recently down on the Burin Peninsula, it can move very quickly through an unvaccinated population. So we want to make sure we have those children protected. And a significant proportion of those children protected.
And I want to ask about COVID testing because we don't know how many people are being tested right now. We know our number of positives is low, but how concerned are you that in fact we may not be testing people considering the form has been down? If you do get tested, up until recently it meant 72 hours of isolation because you couldn't get those results. And so because of that, people may have said, you know what, it's the sniffles, I'm not going to bother. And that may be why we have low case counts rather than it's because we have few people with the disease.
Right. So, we do monitor in other ways. So we have wastewater monitoring that we do that we haven't really seen any major signals with to make us concerned in that regard. But, it is quite easy still to get a test. And even though the form was down, there was still there was a workaround for that during the time that we were testing. So I think people are coming forward as they always have to get tested. There's probably always been a certain percentage of people who may have thought it was just the sniffles, and I think we saw that with that school outbreak that we had. So, I'd like to take the opportunity right now, really, to reinforce the importance of getting tested if you have symptoms. We know that COVID can come in. We're seeing more and more that there are breakthrough cases, and so people can be fully vaccinated and still have this virus, and so there is that potential for spread even in people who are fully vaccinated. So if you have symptoms, we want you to get tested, so make sure you do go on and do that the self-assessment and referral form to get your test done, because when a positive test that we know about is one that we can try to contain, so we want to make sure that we're able to do that.
Our next questions are from Jody Cook with NTV. Please go ahead and make your way to the mic.
Hi. So, approaching our 2-year mark here into the pandemic, you indicated endemic, and that's a light at the end of the tunnel, certainly. But seeing these goalposts have to move throughout this as the Delta variant comes in, we see the 90%, and then as indicated today, waiting for kids to become vaccinated. Without that program actually even initiated yet, are you able to put a timestamp on when you think we might actually start to see some significant change in how we live life?
That's the $1 million question, I think. I don't know that any of us can really do that at this time. It will be really important to see what happens when we have kids vaccinated and how that affects the epidemiology and how that affects case counts and what we see, with regard to outbreaks and things like that. The other thing that we have to watch very carefully right now is that waning immunity that's been happening, that we've seen happening in those breakthrough cases, and then of course there's the vaccination of the rest of the world that has to happen. And, as long as COVID can circulate, COVID can mutate. So we want to try to keep that circulation down as best as we can, and the best way to do that right now is with vaccinations. So we are keeping an eye on a lot of things, and this is ever changing, but I think we are seeing some strides towards, being able to live with this virus. But it isn't flu just yet. It still results in more people being hospitalized than flu. Even with vaccinations, we still see that. The vast majority are still in unvaccinated people, but we are still seeing hospitalizations. So we still need to be careful that we don't think about this virus like the flu, because they are two completely different viruses.
Thanks. I'm just going to change direction actually off the second question that I'd had for you based on what you've just said about waning immunity. So we are seeing in Ontario right now with these upwards of 700 cases a day, up to 50% of those are double vaccinated. So is that causing some different dialogue happening here now among health providers?
We're certainly watching that very carefully. And, we know that that immunity is waning, and certainly for symptomatic COVID disease, we're seeing that, we're seeing more cases in those fully vaccinated. But the protection against severe disease, so against hospitalization and death and ICU admissions, that is still, there doesn't appear to be significant waning at this point from what we've seen in that regard. But that is something that we're very carefully watching. And NACI is very carefully watching that as well, and as they, deliberate to think about their recommendations with regard to booster doses and things like that. And part of the reasoning for the booster dosing, the groups that we recommended, was because of people who are who are more vulnerable or maybe at a higher risk for having that waning immunity.
We will now go to the phones. Our next questions are for Richard Duggan with VOCM. Please go ahead.
Thank you. I want to ask about the regulations that Minister Haggie was talking about. I noticed when I was going through them that a date has been set of June 1st, 2022 for those regulations to expire. I was just wondering why that is.
That's a good question. I think when we introduce regulations, restrictions, or mandates like that are
Newfoundland Labrador, speaking.
A little out of what we usually do, some people would regard those as an infringement of their liberties or a challenge to the Charter. And I think partly this is to show that we are sensitive to those discussions and that this isn't in perpetuity. So that was a date that we felt the government was reasonable to set. And if there is a need, these regulations can be continued. And if there is no need, then these regulations can expire. So I think that was to show that we are not overreaching. We are being thoughtful and considered in the approach that we brought forward.
And does this mean that that you would expect that other regulations and mandates around COVID could be repealed or ended by that time, such as the similar mandate for government employees?
I think that's part of a general discussion, and I'd loop back to what Dr. Fitzgerald said about epidemiology and the situation at that time, and the questions from your colleague about how we have changed as the science and as the knowledge around COVID-19 has changed. We have, I would argue, been very nimble in responding to it, as evidenced by our exceptionally good figures, both in terms of low case counts, containment of outbreaks and clusters, and the excellent vaccination numbers that we have at the moment. So this is just part and parcel of that.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Hi. This is a question for the Minister. The website section or page dealing with exemptions for the VaxPass has, for the past few weeks now, said more information in the coming weeks. Today, apparently, we've been told that there are at least now templates available for this form for doctors or nurse practitioners. Do you have any record of how many exemptions have been applied for and or approved?
One of our challenges around the comment around not being updated or waiting has been the issues around our IT problems. I can't give you that figure offhand, Peter. I can certainly go away and see if I can find a number, bearing in mind our IT systems are really just coming back to functional at the moment, but I can go and ask.
Okay, thank you. And can you tell me whether QR codes have been issued to anyone who has a vaccine exemption?
Similarly, I couldn't tell you that at the moment. I know there was a hold on new QR codes being issued because of our IT challenges. So I would have to go back and ask that question too. Happy to do it.
Okay, thank you.
Our next questions are from Renelle Legros with All Newfoundland Labrador. Please go ahead.
Just going back to the regulations that come into effect on December 17th, and my apologies if this was already addressed. I missed a small portion of the announcement earlier. Businesses with that require a Vax Pass, do all employees of those businesses need to be fully vaccinated by December 17th, or are we just talking about frontline workers?
That's a good question. For detail, I would actually have to go and verify that. But my understanding is the big picture of this is to encourage everyone to get vaccinated. That's part of the driver behind this. It is certainly the expectation, the way things are written, that anybody who is in public contact would have to be fully vaccinated. And I believe, but I will check, that that would include people who were in the back, as it were.
And just to clarify, there's no concerns right now with regards to the IT outage to have this done by December 17th. This is a month away, so all of the COVID-19 tools are back up online. There shouldn't be any delay on that front.
The issue around proof of vaccination, we have several ways you can prove vaccination. And the card, the paper record that you were given at the time you actually get your shot is perfectly acceptable. And all you need in addition to that is a photo ID that shows the same name as is on those cards. So even in the absence of electronics, there should be no delay or no hiccup in reaching that deadline.
I'll now go back through each reporter to see if you have one final question. Peter Cowan with CBC, do you have a final question?
I do, and that's about enforcement of the new vaccine passport rules, especially for employees, etc. What's being done to make sure that businesses are in fact complying with this? Are there spot checks? And are you aware, have there been any charges or any enforcement action taken so far with the vaccine passports required for customers of these establishments?
Certainly from the point of view of enforcement, that would fall under a variety of different agencies, none of whom actually fall under the Department of Health. So there's an occupational health and safety piece, which would fall under Service-NL, DGS-NL. And in the case of an establishment serving alcohol, there would be the issue around the NLC and their inspectors. And for a kind of default, there is local law enforcement. So I can't speak directly to what those agencies have and will be doing, and maybe that would be inappropriate anyway. In terms of charges and tickets, I don't have that information. Certainly the RNC or the RCMP and those departments will be able to provide you with those figures directly because health doesn't track that.
Jody Cook with NTV, do you have a final question?
Yeah, we're still hearing some business owners complain that some of the restriction and capacity liftings are arbitrary and not necessarily working for everyone. Is there another review in place for that? For instance, with the entertainment industry and restaurants and so forth being allowed to operate at full capacity, but yet some smaller businesses like yoga studios can't?
Yeah, thanks. So we are looking at all of that right now, and so certainly as we move forward, we are reevaluating all of that, as we do all the time anyway. But so I anticipate there will be some further information about that in the future, near future.
Richard Duggan with VOCM, do you have a final question?
Yes, I do. Dr. Fitzgerald, you said that you're looking at about a 4 to 6 month window to get school kids fully vaccinated, that 5 to 11 age group. The province is promoting next year as a come-home year. Do you have any concerns about there possibly being an influx of people coming into the province in that period before kids are fully vaccinated?
So, you know, the anticipation is that we'll be able to start things before the end of this year and be able to get most of those kids in with their first dose in the early part of 2022 at least. And then depending on what the recommendation is from NACI with regard to optimum interval between doses, I guess that will determine how quickly we can get those kids in for a second dose. We anticipate that there's going to be a significant proportion of people who will be very eager to get their children vaccinated as soon as the vaccine is available to them. And then, there will be others, as we've seen with our vaccine uptake for adults, that may take a little bit more time. So I don't anticipate that there will be any issues in that regard. But we're going to be working very diligently to get the majority of those children, 90% of them, hopefully vaccinated as quickly as possible.
Peter Jackson with the Telegram. Do you have a final question?
Yes, some drug companies, Pfizer, Merck, are on the verge of introducing antiviral pills now to the market, and from what I can tell, they're not related to any sort of horse medication. Do you think these will be any kind of big game changer in the same way vaccines would be?
Treatment and these medications are getting a little bit out of my scope, but, certainly some of the studies look promising for reducing the impact of COVID-19. It's difficult to tell at this point. I think as we get to use them more and, depending on the recommendations for how we should use them, I guess time will tell. But I certainly wouldn't want to speak out of turn. It might be better posed to somebody who's, working more clinically with COVID patients.
Thank you.
Renella Grow with All Newfoundland Labrador. Do you have a final question?
I'm good, Leslie. Thank you very much.
Thank you, everyone. Minister, do you have any final comments for today?
Yes, thank you, Leslie. Thanks, everyone, for tuning in, as it were. I was struck, actually, by a couple of the questions around returning to normal. And what I kind of compared was where we are now with where we are in, say, May or June of 2020, or indeed in the winter of this year just gone. People are going to performances, looking forward, hopefully, to get an opportunity to hear Shalloway again with some seasonal music. Social and organised gatherings are going ahead, and the capacities, as Dr. Fitzgerald referenced, have increased. You can dine out, and there's a wealth of those kind of establishments across the province. So I think if you were to look at that in the context of where we were in March of this year, for example, we have made significant strides, and it's happened because of the excellent response from Newfoundlanders and Labradorians to Dr. Fitzgerald and her team and their recommendations. So once again, if you haven't got the shot, go get it. And the flu shots are out there, and you can go, and there's no charge for a flu shot anywhere in this province. So I'll paraphrase Dr. Fitzgerald and say, hold fast and stay safe, and thank you for your time.
Thank you, Minister. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan. So Jan stayed home, and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.
The following program is brought to you by Rogers Anyplace TV. Enjoy exclusive content for free. Visit RogersAnyplaceTV.com.
If you have a comment about this program, we'd love to hear it. Email or call us, or send us your feedback through social media.
I'm Carl Wells, getting ready to record another edition of Carl Wells Point to Point. It's a program where I chat with members of our community, and they talk candidly about their lives and careers, from their earliest dreams to their greatest